Today, we have a lot to be thankful for. Our families, friends, health, and antibiotics. Yes, you heard that clearly, antibiotics. You know, the antimicrobial drug used in the treatment and prevention of bacterial infections, and arguably the most important medicine in our history. Now, let's imagine that we lived in an era where there were no such thing as antibiotics. What would life be without them? Well, let's find out by going back in time to 14th century Europe and witness the Great Plague pandemic known as Black Death. The Black Death was one of the most devastating pandemics in human history that resulted in the deaths of an estimated 75 to 200 million people in Europe between the years 1346 and 1353. It arrived in Europe when 12 Genoese trading ships docked at the Sicilian port of Messina after a long journey through the Black Sea. The people who gathered on the docks to greet the ships were met with a horrifying surprise. Most of the sailors aboard the ships were dead, and those who were still alive were gravely ill. It was an epidemic of bubonic plague, a disease caused by Bacterium Yersinia pestis, a bacterium that circulates among wild rodents where they live in great numbers and density. It was thought to have originated in China, where it then traveled along the Silk Road reaching Crimea by 1343. From there, it was most likely carried by oriental rat fleas living on the black rats that were regular passengers on merchant ships. Infected ship rats would die, but their fleas would often survive and find new rat hosts wherever they landed. They readily also infest clothing of people entering affected houses and ride with them to other houses or localities. From the bite site, the contagion drains to a lymph node that consequently swells to form a painful bubo, most often in the groin, on the thigh, in an armpit, or on the neck, hence the name bubonic plague. Spreading throughout the Mediterranean and Europe, the Black Death is estimated to have killed 30 to 60% of Europe's total population. Meanwhile, in a panic, healthy people did all they could to avoid the sick. Doctors refused to see patients. Priests refused to administer last rites. Shopkeepers closed stores. It even affected livestock. Many people fled the cities for the countryside, desperate to save themselves, and they even abandoned their sick loved ones. Today, the sequence of events are terrifying but understandable. In the middle of the 14th century, however, there seemed to be no rational explanation for it. The Black Death epidemic had run its course by the early 1350s, but the plague reappeared every few generations for centuries. Modern sanitation and public health practices have greatly mitigated the impact of the disease, but have not eliminated it.